Good evening, everyone, and a warm welcome to our live medical discussion. I'm your host, Tharuka Prematilaka. Today, we are lucky to have not just one, but two doctors, experts in psychiatry, as well as obstetrics and gynecology with us, who will be educating us on an incredibly important topic: mental health and well being of couples during fertility, pregnancy, and postpartum. We're going to talk about real issues that couples might encounter during their parenthood journey, but avoid discussing openly. So, this is as real as it gets. It's time to have open conversations about these, and today's session is going to be just the beginning. Now, before I introduce our doctors to our session today, there are a couple of things that I want to inform you. First of all, this session is being live streamed through Dr. Prabodhan Ranavira's official Facebook page, YouTube OB-GYN channel, as well as Mums in Colombo Facebook page. So this is a platform where mums can ask questions, raise concerns, or even share mums jokes. So if you haven't heard of it, go check it out later. And we have received an overwhelming number of questions today. So we are going to talk about an array of topics. And while we discuss these topics, we will also address those questions that are relevant to what we are discussing today. And please bear in mind, whatever the comments or questions that you post during the live will no longer be anonymous. So we kindly request you to keep your comments and questions relevant to our topic today. And lastly, a small trigger warning: we might be discussing some issues that could be somewhat sensitive for some couples. So please be aware of it as well. Now, without further ado, let me introduce our two doctors. I will first introduce our very special guest today. When I plan this event, actually, I knew her as a doctor, but I now have the absolute pleasure of introducing the latest professor in town, Professor Chaturi Suravira. So please join me in congratulating her for her achievement as well. And Professor Chaturi is a consultant psychiatrist at the National Hospital of Sri Lanka, and she is also a professor in psychiatry and the head of the psychiatry department at the Colombo Medical Faculty. And as always, we are pleased to welcome back our very own Dr. Prabodhan Ranavira as well, who is a consultant obstetrician and gynecologist at the De Souza Hospital for Women and National Hospital of Sri Lanka. And he is also a senior lecturer at the Colombo Medical Faculty in the Department of Obstetrics and Gynecology. So welcome to both of you.
Thank you.
All right, let's get started with our very first question. So this lady is saying that she is 29 years old and in the fourth month of her marriage. She has been experiencing vaginismus, which has made intercourse difficult and painful, often requiring her to stop due to pain. So she would like an explanation of available solutions to address this issue. So before I move on to Professor Chaturi, Dr. Prabodhan, can you quickly explain to us what vaginismus is and what are the medical reasons that could cause this and the treatments available? And then we'll go to the psychological perspective.
Yeah, thank you, Chaturi. Taruka. Now, the vaginismus is, when you say vaginismus, it's actually a medical condition. It's a kind of a really difficult disorder to treat. And now, when you say vaginismus, it's actually like when you even touch that area with even a cotton wool, it will start paining. But that's a medical disorder. But for majority of Sri Lankans, what we have is something called superficial dyspareunia, which is that at the start of the sexual activity, or when somebody tries to enter, that is painful. Now, that is nothing to do with anything abnormal. In my career, from as a medical student up to now, I have only seen three, patients who had actually had a problem with the vagina. One didn't have a vagina. One had something called the very narrowing of the vagina, which is a congenital abnormality, and the other one has a large septum. So now, apart from that, I have, helped a lot of couples when it comes. This is a part of sexual dysfunction, which Chaturi will be also talking about it. So now there are, like, when it's now what she describes for me is what we call superficial dyspareunia, which is the commonest form of sexual dysfunction that we encounter in our practice, day-to-day practice, because of the way most of the Sri Lankans are brought up. Now things are changing, but in our schools there are no proper sex education, and if there's this problem is actually partly due to the man and woman both. So because the woman who has absolute no education sometimes, and then for majority of Sri Lankan women in the the now this era, which we all went through that, but the future will be slightly different, hopefully. But for majority of Sri Lankans, like having sex is like never going to school and somebody is giving you an A-level paper, because like they will, sometimes force marriage or whatever. They will, pre-marital sex is not, like it's a taboo, and there's no graded exposure, so they are married, and after that somebody will give her sometimes even a white sheet and then lock him in a room and go away. And that's one reason. And then for the partner or the husband, majority of them will learn sex by watching what we call porn movies, which is and which causes a lot of issues again, right? So there's a big and they also don't know. That's the main issue. So the whole, there is a big issue which like it's very difficult to, as I told you, each couple is very different, right? I can tell you a story where uh, you know, how I got involved in the what we call management of sexual dysfunction, or this part of it. When if it is really more like somebody if they had no sexual desire, like have big issues, then I'll be sending to Chatri or somebody for more of a high, end treatment. But most of the time, it's just counseling and little bit of exercises and believing in self will help. Now, my main couple, which I met, nobody has come near that. Like that is my trophy couple, because I met them in 2009. I just started my career, and then they have been married for 8 years, never had sex, and at that time they were going to divorce. But now they have 3 kids. The funny thing is, both of them being doctors, so they knew where to find help, how to get help, but they have not done anything. So this is very, very common, regardless your education level, whether you know it. It's about how to. So it's something like uh, a separate topic that we need to discuss there. But for majority of them, when it comes to fertility issues, that's maybe the issue. Okay. Yeah.
All right, thank you, Doctor. And moving to Professor Chatri, what are some of the common psychological factors that may affect vaginismus, and what kind of support can women receive for that?
Right. Uh, this is a very important question, Taruka, because a lot of us, as Dr. Prabodhana mentioned, do not know what we are getting into when we are getting married. Like, hopefully, things are changing, but as of now, like, it's not discussed what sex is all about. And like the men, they used to get the education from porn movies or whatever that they are watching from, or what they have heard from the others. So they have this particular image or this idea what sex is all about. And for women, most of the women, although we think that this is something that should happen, that is taking place among married couples, they do not really know what it is all about. And for both parties, most of the time, I have figured that they don't know that it's a process. Like there are processes called, like, there are stages, like, foreplay, and which leads on to another one, so that that the partners are prepared to the next stage in their sexual intercourse, so that there is enough lubrication, so that it's in lay terms they call it, like, wet, and getting wet and all that. So those things, so what I have found out is, because of lack of knowledge, there might be certain barriers. Like, some women tend to think that this is not painful at all. I don't want to scare you off, but then sometimes knowing that it might hurt at the first attempt helps. Because when you go attempt the first time, knowing that, and without anticipating any pain, and then some people experience a huge pain, then they get aversive to sex for years. So that's one thing which could happen at the end. And then from the man's side, they also do not think of this as something that might hurt. the female partner. So that is also something that needs to be aware of, because and the difficulties that partners come up with and that difficulties they face are not discussed. Only the nice things are discussed. And like even in the movies or the books, only the nice aspects are discussed. But it's good to know that there are difficulties in this as well, so that everybody knows, no, most, I mean, not most, a significant proportion of women cannot have sex in the first night. They struggle, but most people don't know that. And another significant percentage can't have sex on the second day as well, which people don't know. And they get scared. Oh, this is happening to me. Why this is happening to me? And the partner is also scared, thinking why this is happening to me. So that's one aspect that all of us women should know about. And then uh, how we have been brought up affects how we look at sex. If we have been brought up in a very, very conservative family where talking about sex is a taboo, and and we are not very familiar with our sexual organs, then this is very, very important to know that they might have problems, because um, they're not open. They don't even know where their vagina is. You'll be surprised that some people don't know where their vagina is. Like sometimes it's very, very surprising, but that's the hard reality. So these people, they are not open. They have to overcome their fears, anxieties. They can't even separate out their legs, and they tend to contract their legs. So just imagine, would they let the husband get near you? So that's another issue. So the overprotective bringing up can contribute. And another issue that a lot of time that women struggle through is previous trauma. People who have been having sexual intercourse without any difficulties might face problems when there are uh, previous bad experiences. It doesn't really have to be sexual intercourse or rape, just like any other types of abuse, like somebody trying to touch you without your permission, likings, that also might lead to certain issues like that. And then if you have bad experiences, like domestic violence at home, father beating up your mom, which has led to fearfulness towards the males, and therefore that is coming down to the husband, might have an impact. uh, and just traumatic experiences, like just any traumatic experiences. And then even people who have been having a good sexual life, if there were traumatic experiences secondarily, then that might also lead to this kind of uh, difficulties, because now they are scared of um, sexual intercourse, so that they are hesitant to open up, they are hesitant to have sex. So broadly speaking, most of the time, as Dr. Prabodhana said, it's the psychological causes that lead to superficial dyspareunia, or difficult, I mean, what most of the time is called as vaginismus. uh, and then that kind of leads to a vicious cycle where they contract legs and they are like hesitant to open up, and then the both parties get frustrated, so the anxiety and stress cause leads to further worsening of symptoms, and then it's complicated by depressive symptoms. So depression leads to lack of sexual desire also. So it's not only vaginismus, it's depression lead to lack of desire, so the complicated cycle starts.
All right, thank you very much, Doctor, for that detailed explanation. Now, moving on to our next question on fertility. Quickly, Dr. Prabodhana, I would like to know, as an obstetrician, under what circumstances would you recommend couples to consider fertility treatment?
Okay, so now again, it's a good topic because now most of the time in sometimes couples come, they have been trying for 3 months, 6 months and all that. And to me, young ones, like usually less than, let's say, 34, 35, from 20s to that time. So they come, and now there's a problem with the new generation that I usually say. Number one is so basically when we say subfertility, that is what we say unprotected regular sexual intercourse for a year, which has 80% chance of pregnancy. If not, then you should seek medical advice. Now, the problem is this unprotected sexual activity, because most of the younger generation now, because they are busy and they have everything is, like what we call computerized. Now, one of the thing is this, there's an app called, I don't want to say the name, so there's an app where you track fertility period. So what they do is they, other days they are there, and then suddenly they say, okay, today is the day, and call the husband, come do it. I can assure you, the 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 husband will not get an erection properly also, right? So this is the normal thing to happen, and then they have this few days. Sometimes the egg has already gone, and then it's like when it's really actually coming, when the husband comes and say, no, today I have my work, today I had a bad day, I have a report to do something like that. And then they have about 3 to 4 times, they have to have, like, they for a month they do have only about 3 to 4 times sex. Now that will not happen because we are going against nature, right? So as humans we have started to have sex for pleasure, which very contrasting to other animals. We and only the dolphins are doing it apparently, right? All the other animals, when they are in the fertility period, the male can detect that the female is ovulating and then have sex, right? But humans, we have a very, very, bad system, because we started to have sex for pleasure. So our males 10,000 years ago gave up the ability to smell the woman and know that she's ovulating. Okay, so the number one is, when a couple come to me, I say, erase that tab, go home, have sex for fun. At least about, let's say, you 1 week of fertility, like a period, we take it off, then you have 3 weeks, at least 2 to 3 times a week for 3 weeks. And like that, at least if you try for 6 months, there's 60% chance. If you try for a year, there's 80% chance. So after that only you will, but for that, if you're trying for a 1 year, the requirements are that woman should be having regular periods at least once a month, right? 35 days is okay, but at least once a month, and should be regular. And then they should not have any sexual problems, right? And there should be any severe pain during periods and things like that, where we think of endometriosis, because like a medical problem. So all that. And the husband should not have like smoking and things. If they are there, we can test prior, husband's sperm sample or something, and then say whether it's everything okay. So by usually when you are like planning for a pregnancy, I keep telling this all again and again, but very rarely a couple will come and tell, okay, we are getting ready for a pregnancy, what should we do? But majority will try for a few months or get pregnant, only comes to us. So important thing is plan your pregnancy, and but don't, the sexual thing, don't plan it, because as I said, sexual intercourse or sexuality should be something fun and something you should be enjoying. We don't have sex to have babies, right? We have sex for fun, and accidentally babies come. So that's how it should be. Okay. So the take home message from the previous one is, like, if they're having sexual intercourse problem, don't try to do it again and again and make a mess of it. Come and meet us, then we can help. Second one is, and if you're having sex properly, don't have apps and things like to find the fertility time. No LH strips. And the other thing is the strips. Every day they put a urine and then come, today's the day, have sex. Doesn't work like that, right? So have fun. And then if after 6 months, or depending on the age, for a 35-year-old, we don't say like wait for a year, but definitely for a 25-year-old, we say don't come near, like come to us until 1 year. Yeah.
Yeah. Okay. Thank you, Doctor. Professor Chatri. So, receiving fertility treatments is not an easy journey, because you have to go through a couple of cycles and everything, and there's always the hope and disappointments. So, what advice would you give as a psychiatrist for couples to manage this cycle of hope and disappointments, and can that stress itself impact the fertility treatments?
Yes and no. Because now let's say if the fertility treatment, the reason to undergo fertility treatment are purely organic causes or obstetric causes or gynecological causes, then it doesn't really have to do with anything to do with the stress. Okay. But then sometimes I have come across couples where if you really talk to them, it's actually, although they have gone for subfertility treatment, it's actually what has happened is what have said. They have not actually purely because it's not going on according to your calendar or
Sorry, Professor
according
Chaudhary,
to their plan.
can I just stop you for a while? You got
Yeah,
disconnected a bit. Can you just
yeah,
quick go like few seconds back and tell again that part? We didn't hear that
yeah.
part.
So sometimes when you really go through the history, what we have realized is exactly what Dr. Prabodhana mentioned. It's not because that there is actual gynecological causes for subfertility. It's because they have not conceived, because they have not had proper sexual intercourse. The frequency is less, and so on. So, um, you just because it has not happened according to your calendar or according to your plan, and just because you have gone through the fertility period and had sex because and you have not got pregnant, that doesn't really mean that you are subfertile. It just means that you have sort of tried to do it mechanically and it has not worked. So that's the psychological factor that I could think of. But of course, let's say if you're really stressed about this, and there are so many times that it might fail, so then you might end up with anxiety and depression. And there also, I have seen couples losing their sexual desire and ending up with conflicts between the couple, which make things complicated, because added to the subfertility problem, now there is a mental health issue, plus there is a relationship issue. We don't have to we have to we don't have to complicate matters by adding on to those things. So if there are issues about fertility failures and repeated IVFs and so on, better to go to a psychiatrist or a qualified psychologist or a counselor, so that you can work
Professor Chaudhary, we lost your connection for a few seconds again. Okay, can you just tell the last bit of what you were saying? We lost the connection during the last bit. Can you hear us?
So until she joins,
Yes.
she sorted, I'll take her from there. Now, what was Chatri was discussing is something very important, right? And now, when the patients start undergoing treatment, right? So what we have to understand is, like, if we take 100 couples who wish that they want to get pregnant or they plan for a baby, 70% of them will get pregnant very quickly without any issue. Okay, so that's important because that is why we are very busy, right? But same way, 30% of the population or the ones who are planning for a baby will have a problem getting pregnant. Okay, 30%. So out of that 30%, little bit of counseling, like they come to us, they like actually if you talk to them, as I said, no, erase your calendar, don't do LH, little bit of information of how, this all these plans work and why the stress have an effect on the pregnancy or the stuff, now what we have forgotten is as a female, not just as a human, but as a female animal, because the important thing is our evolution is lagging behind. Right? So we develop so fast. So our body still doesn't know that we can get pregnant, we can eat whenever we want. The body still thinks that we have to hunt, gather food, and do all that. So in the younger days, we had only one stress, that is food. If there's no food, our what you call hypothalamus gland will detect it and then stop the pituitary gland from secreting certain hormones, which cause the ovaries to ovulate. So it's simple as that. So if you get stressed for whatever reason, it may be your work, it may be just the fact that today is the sex day, or your mother-in-law asking where is the baby, or mother is asking where is the baby, or you are thinking, okay, why I'm not getting pregnant, or whatever, or the work stress, exams, whatever. So whatever the stress, the body thinks no food, no food, no babies. So that's the law of nature, right? So we are trying to go in against that. That is where, we make things right. And same way, so as I said, 30% with little bit of help, 20% will get pregnant, right? So now that is how people will start looking for doctors, right? So because, 30 people came to you and 20 will get pregnant and they think, okay, so those 20 will say that doctor is good, and then people will go and start doing those things, right? But 10 will not get pregnant. Out of that 10, 5 will get pregnant with little bit of hi-fi stuff, like maybe IUIs and things like that. Yeah, they will have a chance of getting pregnancy. So if that happens, so then now those, how do they do it? That the only doctors know. The patient doesn't know who's doing it properly, what is the correct technique, whether they are doing little hi-fi stuff and all that. That only the doctors know. The patients will not know. Now, out of that 10, so 5 will still doesn't get pregnant. Those 5 will need IVF treatment. So sadly, in Sri Lanka, IVF is not free. So if you take 200 couples who need IVF, only one could afford it. And 199 will do various other stuff, right? So that's the important thing. So the now when you start fertility treatment, I see people keep on going and then getting stressed. So initially the eggs, the medicine that we gives to get eggs out, initially they work very well because you go with a lot of hope and all that. But first cycle, she's not getting pregnant. Then the next time the eggs are less, because what we have to remember, each time you try, whether it's natural conception, natural conception chance is only 20%. 80% you will get a period again. IUI, which is the insemination, 25% get pregnant, 75% you will get have a period again. So that now if you try for 6 cycles, only that you have 70% chance. Okay, so important thing is to like do not like you the get not getting stressed. Like the moment you get stressed, sometimes when I treat, after about 2-3 cycles, I see the X levels are coming down and all that. I say here we are going to take a break now. Go home, have fun for 3 months, and come back. Don't think about babies. Go on a holiday, have sex for fun, and in those instances, many have got pregnant because they are going to have sex for fun. So the important thing is to kind of believe in yourself, and then so nowadays most of the time no babies is issue for the surrounding people, not for the couple, right? So then that causes a lot of stress for the others, right? And also the partner, because in Sri Lanka some of the people still think it's woman's fault and all that. Because you have to remember, 30% man problem, 30% woman problem, 40% man and woman both problems. Right? So there's a 70% chance that the problem is either husband or both. Right? The 30% husband, 40% both. Right? So it's always like that. Only very rarely, 30% will only woman problem. So we'll always think that that is the issue. Right? So woman is blame and all that. And then especially if the partner is not supportive, for like when it comes to fertility, and then that's not going to work most of the time, right? and uh,
All right.
and I would go to the extent, if your partner is not supporting for that, I mean, no point even hanging out.
Right.
That's what I usually say, because it's that stress is no point.
All right. Thank you, Dr. Prabodhana, and glad to have you back, Professor Chatteri. So let's move on to our next question on pregnancy. Now, this is something that we can talk for days as well because it's multifaceted issues are there. But let's just focus on the question that we have today. Professor Chatteri, can you explain to us how does the level of family and in-law support impact a pregnant mother's well-being? what signs indicate that this support may be too overwhelming for them or too insufficient as well? Because sometimes I've seen even in Moms in Colombo page, some say like, it's too stressful. They will have opinions for everything. And then there are myths surrounding pregnancy that comes into play as well. And then some would say like, they don't receive any support at all. So how can this be managed, and what advice would you give for family members as well, like, to manage it in a way that it's not causing any undue stress for the mother or even the father?
Yeah, pregnancy is supposed to be a happy time. And also, uh, although it looks as if it's all about the couple and the baby, it's not so. It goes ways beyond, like, to the in-laws, the grandparents, the nieces, nephews, and the children already there. So it's very complicated. And all these complex relationships are ultimately going to have an impact on the pregnant mother. So, first thing, there are lots of myths and wrong assumptions that are going around. Now, let's say, for example, if there is a miscarriage and this pregnant woman has gone to work, it will be blamed for going to work. And if this pregnant woman has been resting at home and she had a miscarriage, it will be blamed for not going to work. And they'll be always compared to mama mama nang ohoma නෙමෙයි හිටියේ මෙහෙමයි කරේ අපේ කාලේ, that kind of sort. So the people have not changed with the times, which is an important thing. And our people have not got themselves updated with the available scientific information. A fine example is there are lots of safe medications that can be given for depression. So you don't have to stop the medication just because you're intending to get pregnant or because you're pregnant. You don't have to stop medications. And some people, they suffer through pain without even taking paracetamol. Why? Because my mother-in-law told me so. There aren't such things. These are additional stressors. And they don't know what to do, what to believe, whether to believe what the doctor say, whether to believe what the midwife say, whether to believe what the obstetrician say, whether to believe what the in-law say, or whether to believe what the mother say. Best is you have to believe what the doctors say because they know what the latest guidelines. And here, this leads to a lot of issues. So that is one side of the story. But the other side of the story, I have seen women who are managing on their own without any help. If you were one of them, you will start appreciating that mother-in-law or that mother who are helping you බැන බැන හරි කෑම ටික හදලා දෙන එක ගැන. So it's a balance because we also tend to overreact. We also tend to think it's our baby. Why can't I make decisions? That's true enough. Yes. So that's why I say that we need to strike a balance. Because just imagine you are a first time mom and you have to wash the clothes, cook, get up in the morning, do the baby stuff, and do everything, and there's nobody to help you. You feel so lonely, and that time you might wish that, oh, what if I had a mother-in-law or a mother or a sister-in-law? So there are pros and cons of everything. So we need to understand not to internalize the positive things as well as the negative things too much. Because I admit there are positive things and negative things. And not to get hurt or not to get too happy with anything. Because sometimes, because they are so helpful, you are exciting towards the first trimester, second trimester, then things starts to change when the baby is actually born, right? And also keep in mind the baby belongs to both sides, not only to mother's side, not only to the father's side, both side. So that is also an issue which I have observed. They should be given to both sides. And also, remember, people are different in their personalities. Some moms might decide to stay home and help you out, but some moms might decide to continue with their work. It's not us to decide on what they should be doing. Because if we start thinking about all these things and start bothering and start getting stressed, it's your mental health that's going to be getting affected. So take everything in the middle path so that you're not affected too much. Yes, it's a bonus if they are helping you, but if they are not, ultimately it's your baby.
Just to
Thank you very much,
add
Doctor.
to
Yes.
Yeah, just to add to what Chaturi is saying, like it's a
Yes.
like day-to-day problem for us. Like I mean, many somebody pregnant where it's overwhelming, this thing. But as Chaturi said, like now if you're in another country, like you and your partner is there, and they will do most of the work. There's no mother-in-law to help or a mother to help. But like like even feeding, though they have a lot of normal deliveries when it comes to breastfeeding, it will be like half, it's no breastfeeding, it's like either like or formula they will be giving. Like the husband has to feed till 12 midnight, and then from 12 midnight to until morning the woman is doing, the husband is sleeping, then he has to go to work and then come back, and everything is shared, like half, right? Because it's both of them babies, right? Now again, our Sri Lankan context, now we can't have the whole cake. That's the problem. We try to have the whole cake, right? So now this is my baby. These are the things I want. And the mother has to cook for me and do this thing. But if I say don't do this, that has not to be done. No, because if you're getting here, they come as a package. There's good and bad both comes. Like if you're taking a domestic, there are good part of that person and bad part. So you come as a package. Then now here you can't get rid of that part, right? So you have to deal with the both good and the bad, right? So either like if you are asking for help, there are sometimes they are doing it over, and then you have to still you know go through it, and you can't say don't do that, don't do that. But then obviously then for the parents, or the what you call grandparents who are watching this program, I have to say, like, now give some space. Like, so I mean, now when you are helping, right, if somebody's helping, as Chaturi said, it's a huge benefit, right? It's actually like like extended families, there's a lot of help. Like your psychology, you get exhausted, you have no sleep and all that, and then because the modern woman has to keep up with the work, keep up with her job, uh, care for babies, and so many things to do at the same time, right? So they are overwhelmed, right? Because everybody, nobody's going to sympathize you because you're pregnant or you are having a baby, right? You have to still go to work, do your job, do your, meet your demands, you meet your deadlines and all that. So the when you are helping, right? So the grandparents, like, please, like, have to you kind of acknowledge what they are going through also. Don't like get angry and all that. So it works both sides, as I told you. But like you have to remember, now once you have a baby, you will do some whatever. So if you have the parents help, that will be helpful, because our the nature is like, all on our phenomenon is there. If you කරන්න බැරි නම් මම යනවා ඉන්න. දමලා දාලා මම යනවා මට ඕන විදිහට කරන්න නම් ගෙදර යනවා. Right? එන්න. So yes, if you help, that will be additional bonus. But that doesn't mean if you don't help, this baby will be, baby is going to die, or we are not going to give adoption, right? So it'll be hard for, like as parents, that will be hard for them to bring the baby, but they will bring the baby up. But afterwards, when things are okay, then they come back, there'll be a lot of issues. Right. So this has to be managed. Right. So as Chaturi said, so there are a lot of issues we encounter with now the like usually it was mother-in-laws earlier, but now it's mothers. Right. So
Yeah,
the conflicts are between mothers and the daughters, which is more complicated, right? Very difficult to, because the husband also can't, manage it. Right?
Yes.
Let's say my mother is having a problem, I can manage her. But then if it is her mother, I can't also go and, have issues. So this is a huge issue at the moment. So the important thing is you all have to, like, the both parties has to understand, and of course hormones plays a significant role in the mental state during this thing. And then, as I told you, a lot of stressors in the current modern world, because earlier days it's your like you have a lot of other family members to help you and do this, but now it's you're mostly alone. And also the grandparents are also working, right? So they are also busy. So these are the modern society problems. So eventually we'll go to this you know what do you call this, nuclear families, and only you and partner. Because I see now, a lot of partners are helping, like, like compared to when I started off my career. Now husbands are bringing babies, they are looking after this, they are cooking at home, which is good, right? So this that part is happening now to a greater degree. So once it's a while, then they become nuclear families, and then other problems starts actually. Yeah.
All right, thank you very much. I think the key thing is, like, it's a support. I mean, a teamwork in the end. So
Yeah.
like, if you decide to go with the team, you have to get all the positive and the negatives and try to be managing it and balancing it well. So moving on to a next question quickly. So how can these, whatever the untreated mental health issues during the pregnancy, can impact the mother and the baby during the labor and the delivery? Either of you can answer that question.
I think Chatur is the best person. Like, yeah.
The untreated, yeah, yes, untreated mental health issues can lead to several problems, and it's not only the mother, baby, but it's the immediate family, the babies, everybody. I mean, babies, what I meant was, like, if there are any other children. So one thing is, they would not give proper, they would not come for services during the pregnancy. So the poor attendants would be there during the clinic follow-ups, and then the stress and the lack of care, the medications will not be taken in properly, and the guidelines, the things that they usually need to do, those things will not be adhered to. So those are the things that might be happening with regards to obstetric care. And the baby is not going to do good either, because whatever the baby is whatever the mother is going through, and whatever the obstetric care that the mother is lacking is going to have an impact on the baby. So it can actually end up with um, lack of adequate growth on the part of the baby, which we call as small for age babies, and so on. So SGA babies, I mean small for gestational age babies. So those things can occur. Now, most mothers tend not to seek mental health help, thinking that the medications might do harm for the baby. But actually, if you don't seek help, the illness might do more harm to the baby, because we have very safe medications now. So that's something that the mothers, fathers, and extended family members all should keep in mind. Uh, and of course, just imagine, when you are depressed, you are irritable, you snap at people, you get into conflicts with your husband and the immediate family members, how unpleasant that is. And you might not pay attention to your children, not pay attention to your husband and the family members, which is going to make things very, very bad. And if you're always lying on bed, people might actually consider you as lazy. මේ මනුස්සයාට කිසිම දෙයක් කරන්න උවමනාවක් නැහැ, ඇඳටම වැටිලා ඉන්නවා. හැමතිස්සෙම තරහ යනවා. So that's how they know, because people lack knowledge about mental health symptoms and signs. So if you don't have energy and you can't engage in your usual day-to-day practices, the other people see it as being lazy, not interested, not being responsible. And if you're always sleeping, they would again blame you for not. And if you're like not going for antenatal care clinics, they would be like not interested in the baby, not being a good mother. So, very, very important. All these things ultimately will have a huge impact on the fetus as well as on you, because let's say if you have diabetes, you're not getting proper diabetic control, going to be an issue. And there are consequences socially as well.
All right, Dr.
Yeah.
Prabodhan, would you like to add to that?
Yes, yeah. Like now, as Chaturi said, like now, if there are medical, there can be pre-existing mental health disorders which are coming, as Chaturi said, some, the because of the pressure from in-laws or parents, they stop taking medicine, and that can cause severe problems. And most of the medical, mental disorders can have an effect on the pregnancy itself, like where they can develop diabetes, high blood pressure, and actually most of the complications that we see in pregnancy are seen at a higher rate when they have a mental health disorder, right? So they are, or what we call untreated mental disorder, right? So it has to be managed as like Shatrikli said, like if somebody is having diabetes, if he's not engaging, then her diabetes is going to get worse, and that can affect the baby. She can develop high blood pressure, and or like so many complications can happen from including preterm labor, and all these have a what we call cascading effect also. So like one problem leading to other, and other one is leading to other, and all that again coming back to the mother, and then make them more severe in their mental health disorder as well. So it's important, like if somebody is on treatment, right, and then to goes out to somebody, like as Chaturi said, there are certain medicine which can be harmful for the baby, so you have to go to a good psychiatrist and then evaluate the drugs, and then see whether what are the safe drugs and continue. So important thing is to give that you know now I know Chaturi does that, like will tell you have to continue this, right? Even if you're pregnant, right? So I usually, when I send to Chaturi, I will say, that whatever she gives, you take, absolutely no harm, right? And then like that discussion should be there. And then if she's taking a drug which is not suitable for pregnancy, so the psychiatrist will change it gradually, because these are not, today you take some drug, tomorrow they take that, then you are okay, because they have to see whether it's working and all that. And then once they are ready, only they go embark on a pregnancy. And during the pregnancy also, new psychological issues can come up. And then so it's important as obstetrician that we detect it, right? So when they are not engaging patient, is there something by psychology, like looking at the face and all that, you have to ask. And the good news is, nowadays, now I don't like this scene in Colombo, but a lot of patients will come say, doctor, I'm having anxiety, I have depression, I feel bad, I need to, can I get somebody to talk to or get, right? So which is very good. They have an insight, they know that there's something wrong, and they will seek help. But sad thing is, in the periphery, or where it's out of Colombo, still when you have a mental health disorder, it's considered as a stigma, pissugani, right? So that's a huge thing, right? So now it's coming down, but still that issue is there. Like people don't like to acknowledge that they can get sick, right? So it's important, like your body getting sick, your mind gets sick. And then if you get sick, like if you get to have a fever, you'll have a paracetamol. So same way, if you're having a mental health disorder, you have to still, if it's medicine needed, it's medicine is needed. There's no other way out. It's not just, now people think just because it's psychiatry and mental disorder, most of the things can be sorted with counseling. Yes, to a certain degree, but when the medicines are needed, it's needed. And if you don't take medicine, like blood pressure, if you don't take medicine, no matter how much you talk, if you don't take the medicine, your blood pressure will go up and you will have all the complications. So important things is that to believe in the doctor, and then and understand that, okay, I have a problem, seeking help. If you need medicine, to continue that with the discussion with the doctor, and then all that, and continue it throughout in a proper way, so that, and get for regular follow-up and see whether there are complications.
Yes, can I just
Just to
say
add,
so?
Haruka,
Yes,
Haruka, I just want to add something there. When you are going to a psychiatrist, psychologist, or a counselor, please see that you check the qualifications, because
yes,
psychiatrists, psychologists, and counselors are a rare species in this country, and there are lots of people who are unqualified. And also, people, because of stigma and discrimination, people like to do without medications. But that doesn't mean just because that those people are offering you counseling and not medications, that they are doing the right thing. They are doing more harm. So check whether these people are registered in the specialist registry. So you can check whether they are consultant psychiatrist or or clinical psychologists or counselors who have proper degrees, because there are a lot of quacks.
Yes, I was going to ask that question actually, how to identify. So thanks for explaining that one. And then also quickly, so both of you were talking like it is important to take the medicines if it's needed during the pregnancy. So now that we know that, can you also explain, maybe Dr. Prabodhana, because you're the obstetrician and you're there at the childbirth. So you have seen a lot. So can you explain to us what is the impact of not taking those medicine? Like, are there any like distressing situations or any panic attacks or anything that the patients might go through at the time of the childbirth? We will talk about the postpartum after that.
Now, yes, of course. Like now, if somebody is like, especially if somebody is having a severe mental health disorder, like conducting labor and even cesarean section or whatever, is going to be a nightmare for us because, like like if somebody's now we don't see people going on the roads with like earlier days when we were young. It's a normal phenomenon, right? So we see people running around road, like not caring for life, like themselves and all that. But now it's not seen so much, but now, that's the extent, like if somebody doesn't take the medicine, they lose their insight, they start neglecting themselves. So, pregnancy is a secondary thing. They don't even like, bathe and wash and all that. So it's all like we don't see to this extent now because of the treatment, and a lot of people are on board with the treatment nowadays in these severe forms. But the slight forms, like, a little bit of anxiety, a little bit of depression, and you need a little bit of medicine because the counseling part has not worked to the extent that we wanted, and then they are scared to take medicine. Then during labor, it's a stressful situation. Like everybody, like from obstetrician to the patient, we all are stressed until we see the baby and baby cries and all that. So it's because I mean things can go wrong. So now when you are anxious about it, and then your pain threshold comes down and you feel more pain, and then that's come into a what you call a vicious cycle where it's more anxiety, more pain, and then they don't communicate, they don't like cooperate during labor or delivery. So that's a big issue, right? And also like especially like now in the hospital setup or the government hospital setup, we can't offer everybody an epidural for a if the pain is that is the best medically proven method to reduce the pain. So if somebody is really complaining of pain, that's something that which can take away pain. But in our government setup, we can't offer everybody who needs a epidural, right? So in those instances where the psychology matters a lot, right? So and then like and sometimes allowing a bystander to be there during labor will help a lot, right? Because you have a familiar face, like rather than like let's say you're claustrophobic. Suddenly, so labor rooms are most of the time, close, entities where you don't see the sun or the moon, right? So those can trigger. So when you're having somebody familiar with you together, during the labor will helps a lot. So these are little things. But to answer your question, yes, if you don't take medicine, if your condition is not controlled, that can have a huge effect labor, even if you're going for a cesarean section during that time also.
All right. Thank you very much for explaining that insightful information regarding pregnancy and how to navigate through the emotional challenges and the psychological issues. Now, moving on to postpartum, Professor Chatri, we have received about 3 questions, so I'll ask 2 questions together. One is asking just to explain and educate women about postpartum. So, like, there are various issues, but I've seen even in moms in Colombo, like issues related to breastfeeding and the myths surrounding it and being forced to breastfeed and not use formula or whatsoever. And then also sleep deprivation related issues and how it can impact the mother's mental health after giving birth as well. And then also like when the baby is crying, new parents are unable to figure out why the baby is crying and what are the signs that would tell like this is something that needs medical help, and how to navigate through these challenges that many mothers and many fathers may face as new parents.
Yeah, Now, having a newborn baby turns the mother's life upside down. And it's not something that comes automatically, especially in this world. It's in this time and day where people are working moms and busy schedules and so on. So although the role of the woman has changed, the the Sri Lankan concept with regards to a mother's role has not changed. The expectations and the role, like the whole family expects the mother to contribute to the loan, but nobody's sort of willing to accept the fact that these people are working
I think Professor Tatari got disconnected again. Maybe
Yeah.
Dr. Prodhan, you can continue from
Yeah,
there for
right.
now.
Okay. So yes, it's very important as was Chatru was telling. Like now, as we were discussing about sex, right? So, like, we are apes, and then we need to learn things, like to do. Like, so motherhood is no exception, right? So, but sadly, as Chaturi said, like now we don't have like a lot of families now. Let's say if you are the now earlier days, now when you are younger, you'll be initially looking at your mother, like you are the eldest, and then you have a younger sister to look after, or you have another relations baby to look at, because we were in an extended family and everybody village helped. But now we have no exposure, right? So you have only two siblings, and even if you have a sister, your sister is having a baby, and you don't have time to go and help, and you have no exposure whatsoever for motherhood. So as if the sex, most of the time, again, motherhood is also like sitting for A-levels without ever going to school. So you can get to do these prenatal classes and all that, to some extent will help you to understand the motherhood. Now, I usually tell my patients like this, come and say, okay, now my back is hurting, my this thing is thing. I mean, I take the baby out quickly. Can't you take the baby? But I say like once I take the baby out, come and tell me what happens in a week's time. And you will definitely say when the baby was inside, it's much was easier. Right. So it's important that, the whole family understands that, like you're not sleeping properly, you are breastfeeding, and then as Chatri said, everybody expects, and also as doctors, and our country is regarded as the number one in the world for breastfeeding. 98% of our women will breastfeed for 6 months, best in the world. So sadly, that the peer pressure is also there, right? So if you don't breastfeed, you don't feel like, you are a mother in Sri Lankan context, right? So it's very, very different to, like, let's say UK. UK, though there is, more emphasis on, vaginal delivery and all that, but when only less than 20% will breastfeed. And like in a country where there are nude beaches, you can't breastfeed publicly. There are protests. Like somebody will say, cover yourself and all that, if you're breastfeeding in a tube station or somewhere. But in our country, it's not like everybody breastfeed anywhere baby cries, breastfeed, right? So nobody has no issues with it, right? So because of that, the whole, it's positive, as well as sometimes it's, when it's overwhelming, it can be negative. So it's have to understand, it's all about your brain, right? At the end of the day. Yeah, Chaturi, sorry, we lost you. Yeah,
Yeah, no, I'm sorry. Yes, my connection is
yeah,
really
yeah.
bad today. I'm so sorry.
That's all
Yeah.
right.
So
Yeah.
I just wanted to add, and if I mean, all of us need to understand that breast milk is not a uniform thing in all of us. Like it's variable. Some people have a lot of breast milk, some people don't. So please don't judge the mothers by the amount of milk they have. Yes, it's good if you can breastfeed as much as possible. But මේ ළමයාට ආදරේ නැති හින්දා නෙමෙයි අම්මට කිරියෙන්නේ නැත්තේ. And if the mother gets stressed, the milk flow is going to get worse, and they are going to end up getting depressed as well. That all of us, and please don't, I mean, and also on the other hand, moms, don't take it as a stressor. එන කිරි ටික පොවන්න, නැත්තම් do something else without getting stressed over it. Okay, because bonding is what is important. You have to be there for the baby, and you have to do it by some way or the other. And if you don't be with the baby and if you end up getting mental health issues, that's going to be worse. So I have mentioned about the change of role, the breastfeeding, and the other thing is hormonal effects, which you have no control over. So if that plays a role, then you will have maternity blues, which about 70% of the people will experience after child delivery. And then the postpartum depression, the postpartum psychosis. Postpartum depression, 10% of the people who deliver will have postpartum depression. It's very common. So, if you all are irritable, the sleep is getting disturbed, if you can't sleep even when the baby is sleeping, if you feel lethargic, lazy, ඔච්චර අමාරුවෙන් හදාගත්තු බබාව බලන්න හිතෙන්නේ නැත්නම්, if you don't feel like taking care of the baby, that's not laziness. That's not being a mean mother. That means you're sick. There are very, very effective medications. If it is a mild depression, you don't even have to have medication. If it is baby blues, you don't have to have medication. But if you do have to have medication, there are very safe medications which can be given during lactation also. So go and meet your doctor, because otherwise the impact of not taking medications are much, much worse than taking medications or taking help. Seeking help is much, much worse. So you have to keep these things in mind.
Okay, I think it's very important that what you mentioned, like, bonding is what matters the most, not the breastfeeding. So I've seen some mothers mentioning that, especially in Sri Lanka, where breastfeeding is being promoted because it's good, but there are some mothers who have always been stressed because if they cannot produce enough milk, they have to give formula. But then there are some doctors who would be against it as well. So, what are your thoughts on it as doctors? Were you
So I
able to
could hear
hear?
you. No, no, sorry.
Yeah, so
Yeah.
what I was saying was like, Professor Thaturi was saying like, if you can't, if the breastfeeding plans doesn't go as planned, you have to have another plan, right? So like in where I live, formula is a very common thing, but sometimes in Sri Lanka where breastfeeding is being promoted a lot because it's good, if the mothers really cannot deal with the breastfeeding, they would prefer to go for formula feeding. But then there are some doctors who would go against it as well, and then the mothers get even more stressed. So, what are your thoughts on that? As doctors, I would like to know. I think Professor Thatri, maybe you can answer that because I think Dr. Prabodhana is disconnected.
So it's all about risks and the benefit. Can you hear me, Taruka?
Yes, I can hear.
Yeah, it's all about risk and benefit, because particularly after a section, cesarean section, the normal milk flow is not established. So until the milk flow is established, if you talk to a neonatologist and then if you talk to the team that looks after the baby, and they will come up with a plan. You don't please don't start make the decisions on your own. Have a discussion with your obstetrician and the neonatology team and come into that decision. And there are certain medication that can be given temporarily to increase the milk flow, but don't suffer in silence. Okay, and there are other ways, like you give breast milk, and you can give express breast milk. Some my moms might say easier said than done, but there are so many ways. So have that discussion with your midwife, with your uh, neonatologist or the pediatrician, without suffering. Otherwise, the baby is suffering because the baby is hungry and you won't get sleep, baby won't sleep. So it leads to a vicious cycle. So discuss it, even the emerge is okay, right? So issues are most of the time temporary thing. So have that discussion and come into a decision.
Thank you very much, Doctor. While we try to reconnect with Dr. Prabodhana, we'll move on to severe psychological disorders. Now, you briefly mentioned about it, the psychosis and suicidal thoughts and postpartum depression. But can you explain a little bit more? What are some of the red flags that family members can look up to? And are these always coming with extreme symptoms like, hallucinations or something? Or can it be having some subtle symptoms during the pregnancy itself, that if the family members were alerted and they knew to identify, they could have been prevented?
Yeah, usually postpartum blues and postpartum psychosis occur during the first week after the childbirth. But postpartum depression occurs roughly after about 2 weeks. But if a mother develops depressive symptoms during the first week, it's very, very likely that the depression started during pregnancy. So I will again say, like, if you're feeling very sad all the time, not having energy, irritable, not interested in the baby, very worried about the baby, so that your head is like a ball of thread and very heavy and aches and pains everywhere, can't eat, can't sleep even when you can rest, and those are red flag symptoms. If you feel like you don't want to live anymore, what's the point in living, and what will happen to my baby if I die, all these thoughts are red flag symptoms. So if you experience them, seek help. If anyone who is closer to you is complaining of these things, take them to doctors. And now there are so many cultural beliefs like Veduge Sanniya, Kalu Kumara Deshtiya, ඔය වගේ ඒවා තියෙනවා. Most of the time, these are features of mental illness. So if a person who was absolutely well is having abnormal beliefs, like somebody has done a malevolent charm, or my baby is losing weight, even though the midwife is assuring that there is no problem with the baby. And if they are very, very concerned about the baby's cleanliness and she doesn't take the baby out of the room and she doesn't allow the baby to be touched by anybody, these also can be symptoms and signs of mental illness. So um, basically those are the things. And also, if a mother is complaining that they are hearing voices that nobody else is hearing, rush to the hospital. If the mother is saying that baby is going to be harmed or there's somebody harming the baby, rush to the hospital. So those are some of the important things that all should know about.
All right, thank you very much, Doctor, for helping us to elaborate on those red flags to look out for and help the mothers when needed. So we were talking about mothers, but I'm sure, fathers will be going through these some of these symptoms as well, like postpartum paternal postpartum depression. Can you explain to us about it? Because that's something that we hardly ever talk about. When we give birth, we usually talk, the attention goes to the newborn baby and then the mother, but we sometimes forget the father from the picture. And there was a question from one of our viewers as well, saying that the husband seems distant with the intimacy and everything as well after giving birth. So she's also seeking advice on how to convince her husband to restore their previous way of life. So first of all, let us know whether this is common among husbands and new fathers, and what are the signs and symptoms, and how can the wives and family members support the husband as well? Because like we said, it's all a teamwork.
Is it me or Prabodhana?
You.
Okay, right. Okay.
Yeah.
So now, again, I'm going to go back to the point where although the concept of motherhood is changing, our culture has not yet changed the views on how the society should be looking at the mother. So still, the fathers are only taking the responsibility slowly. So mother should be up during the night. Tata will go with the uh, linen and the pillow to sleep in the couch because he doesn't want to be disturbed. So, but I mean, as women, we have to appreciate that also. Because if we have a lot of expectations and if we are not aware of the fact that the society has not changed because of our high expectations, we are going to get into trouble. It's one thing that we have to make them aware and get them to help us, but overnight we can't expect them to change their roles. So that's one thing. So get them to help slowly, be there patiently, and don't get. And sometimes I have found that the way we say things to the husbands, make a kala den, araka karan, that pisses off the husband as well. So those are things that we need to keep in mind because, they might think that, you might think that, I'm being a little bit too passive and all that. But then this leads to conflicts between the couple at a time where there should not be conflicts. And then you might feel really alone when he gets upset and so on. So that's one thing. And husbands also are living in a world of myths. Some husbands think that they should not be having sex, and some husbands think that they should not be disturbing. හොඳට කරපු දේ wife සමහර වෙලාවට නරකට දැකලා. So husband comes and wife comes and complains to me that he is not having sex. And then when I talk to the husband says, අනේ ඉතින් මෙයාට කවුනේ මහන්සිනේ මං නින්ද දෙන්න නිදා ගන්න දුන්නා කියලා. So there are miscommunication which are leading to problems as well. So have that chat with the husband. And also, there is an entity called paternal postpartum depression. Husbands get depressed too. So if the husband is irritable, if the husband is feeling distant and so on, be careful. They might be feeling depressed. After all, in first time fathers, this is the first time that they are becoming fathers too, right? And they have been brought up in a way that babala hadalat naha, pan ekak ustalat naha, nappy ekak maru kallaත් naha. So it's a difficult life for them as well, and their responsibilities have increased. They have to find money for 3 people now. So be mindful about those things as well. While we are undergoing our own problems, they are also battling their problems.
All right, thank you, Professor Chaturi. Quickly going to Dr. Prabodhana very quickly. So that's about the husbands, but then I'm sure you may have come across where women also have this issue, and then the husbands are complaining that the whole intimacy is gone. So how can they manage to find a balance between these relationships while also, going through this new parenting journey together?
Right. Okay. So just to add a little, now this is important that you said it important that all, now when it comes to husband and partner both, right? So I usually say now, as we were discussing, like soon after childbirth, whether it's a cesarean section or even a giant deliveries, there are sometimes we have to put incisions and there are tears and all that. So I usually say don't have sex till about 6 weeks, where the body is adjusting, you are adjusting to new conditions, the sleep and cycles, you get into a rhythm and all that, and then like the work and all that happens. So initially you kind of both of you all are learning, so you learn and then they have discussion. As Chatri said, it's very important that you discuss like what are the concerns, and in a friendly way, right? Both, right? So I need you to do this, I need you to do that, and then what you expect from you, like this nowadays it's more of you father and mother, and then sometimes, especially in Colombo, like help from the parents are much less, right, and other, but in the villages still it happens. But as Chaturi said, it's important that like now there's no earlier days, yeah, the woman is looking after the baby, you do go to work and come back and they do nothing. No, now it doesn't work like that anymore, right? In most of the families, both are working, both are equally, like busy and all that. So the important things are, so when it comes to intimacy, I usually say wait for about 6 weeks, then start slowly, like like, and in the first instances use some lubrication, where because the first time you start trying and then there's pain again for the next sometimes few months, there's no sex again, so it has to be. And then as Chaturi said, the father is scared that he might inflict pain, and the other way the woman will think, okay, he doesn't want me anymore because my body is big, my this thing is big, the it's important that you all have the discussions openly about the whole intimacy part, and that will help you to navigate most of the problems or common problems which are associated with restarting intimacy after childbirth.
All right, thank you very much, doctors, for those insightful information on navigating the relationship while also caring for the newborn baby. Now, moving on to our last few questions on siblings. So we have received 3 questions, but given the time, I will try to summarize the questions and ask both of you. One thing that they have asked is like, what's the best age gap to have between the siblings? So I would like to know the perspectives from a medical perspective from Dr. Prabodhan, and also from emotional well-being of the older sibling from Professor Chatri as well. And other than that, so these are the 2 questions. One is saying that she's 32 years old, and she seeks some guidance on how to prepare her child for a new sibling, particularly since the child is closer to her more than the father. And so what are the, like, the psychological factors of the older siblings that should be considered by parents when planning for a pregnancy, and what to say and what not to tell the sibling, and at which age do usually small kids understand the concept of sibling and sharing love and not feeling neglected or lack of attention from the parents because of the newborn. And then the other question is asking, she already has her first baby, but when the baby cries at night and doesn't sleep, she feels exhausted, that she doesn't feel like having another child, although she wants to. So, how to overcome this feeling as well. And the last one is about gender stereotypes. Okay, I think Professor Thatri got disconnected, so we can start with Dr. Prabodha. Can you first explain from a medical perspective what's the age gap to? What's the best age gap
Yeah,
to
right.
have? And
So
then we can get Professor Thatri's inputs as well.
right. Okay. So the best thing is, now the recommendation is to wait for like the gap between the babies should be at least 2 to 3 years. So number one is, if you get pregnant within a year of the first child, and then your body has not come back to normal, you are still coming out of the whole thing, and so going through the whole physically as well as psychologically the same journey may be difficult. That's number one. Number two is the other way around. That is, like, if you wait too long, like let's say 4 years, 5 years, 6 years, then the bond between the sibling will be less. And then again, then you are again, like, you have set into a rhythm so well that you don't want to change. Right? That's the other issue, because you have gone through the whole the baby thing, and then now you are sitting back, the baby is sleeping in a correct time, and you know that the baby is going to school and all that, and then suddenly you think of having a baby, and the whole system collapse again. So best would be to have, about, you have to decide how many number of babies you have. And I usually believe that at least having 2 babies helps in a lot of ways, in the thing, but it's actually your, the parents' choice, and because that give the for the other child also having another child helps a lot, right? But anyway, that part is the parents' concern or the couple's concern. But the important thing is, now when it comes to the other child, especially if the child is older, like 3, 4 years, then he's in this stage where everything belongs to him. So suddenly, then you are the king of the whole, or you're the center of attention, and suddenly somebody else is taking that attention away from you, the baby will get distressed. So important thing is that um, uh, important thing is to kind of one option would be one parent will be spending more time with the older child, right? So that now, as personally, in my kids that were time, because we also waited a little too long to have a baby, right? And then like I was with the first one because he was older, and then he was getting upset because everybody's getting attention to the younger one, right? So there are different techniques we can use and to discuss, and even with the child, because they're bigger. If they're smaller, then the issues are less, right? And then they'll be okay. But the parents will be more exhausted and all that. So it's a balance, as I said. You all have to decide how many babies, and when you're good at the WHO recommendation is 2 to 3 years, which shows for good for both mother and the or the parents as well as the siblings.
All right, now that we know that, the age gap, Professor Thatri, can you quickly elaborate on like the mental well-being of the older sibling, what to consider when somebody is trying to conceive for the second time, and what not to tell and what to tell for the sibling?
As Prabodhana said, it's very important not to have the gap too small or too large, because otherwise it's it's awkward for the older sibling as well as the small siblings. In our society where the sister is being called as mother and so on. Okay, so we have to. I mean, there are always unpreventable things, but then better to be careful about these things. And the other thing is, it's always best to prepare that there is another sibling coming. And if you are if you have decided on having 2 or 3 or 4 kids, uh, to always prepare the child mentally, even when the child is living alone, to share and care. And because sometimes if the baby has been given all the priority in the world, and no delays, no shortages, then the toddler is not used to having delays, not used to having patience, not used to sharing and so on, which might cause problems later on. Having said that, please don't say, because you have been good, I'm bringing home another baby for you as a gift. Don't resort to these kind of things, because I'm not saying that this would happen. In a case of a loss, a miscarriage or something, then the little child might start to feel guilty and feel responsible for what happened. So please be mindful about that, because you were behaving, then they might think, because I was misbehaving, that's why I lost the little brother or the sister, right? So those things. And when the baby is there, all of a sudden, please don't think of the next baby as the center of the world now. Allocate time for the older child as well. What you can very clearly do is get him to do some shows, like get him to get the nappy, because most of the parents are very, very overprotective. Alanapa, alanapa, that kind of thing. So that child gets kind of cornered, and that's what brings the child to develop sibling rivalries and so on. And don't ever compare, because your sister is like this, but you used to always bother mommy by keeping up awake and so on, because that hurts the child, because it's not his or her choice to keep awake in the night. She was just a kid. So those are some simple things that you can do.
All right, thank you very much, doctors. I think we only have about 3 minutes left. So quickly, there was one question that asked how to overcome the feeling of not wanting to have a second child because of the exhaustion. Can you just, in 2 minutes, quickly give some advice on that, Professor Chatterjee?
It all depends on how the experience and how the support systems and everything is. But we have to remember, our first year of school was different from the second year of school and the third year of school. Our mother was different from the father. Our older sister was different from the younger sister, and so on. So, just like that, not all the experiences are going to be bad as well as good, and life is also not going to be like that. S-
Dr. Prodher, do
And
you want to add any
yeah,
last
same thing.
words
Yeah.
before we
Yeah.
finalize?
So basically, like again, like with this thing, I have many instances where the moment the delivery happens, so I will never do this again. This is my last, first and the last. I will not come. But in sometime 3 months, they are pregnant again, right? So so it should not also happen. So you have to plan things, and then in the modern world, because there are so many other responsibilities and other challenges, so you have to decide the how large your family going to be, and nowadays we don't see big families, so you have to plan things, and then when you're ready physically and psychologically, you have to do it. But one had to remember nobody's going to be 100% ready for a child either first time or second time ever. Like like we say, okay, now we're ready. Nobody can say that, right? So everybody, there's a problem. But when you are somewhat ready, if you're planning to have a baby, finish it. The important thing medically is before 35 years, if you can finish your family, that's better, because in the future, and to add to a little bit what Chatri said about the sibling, please don't tell your child that you're going to have another sibling until at least after 12 weeks scan, where we can detect certain anomalies and sometimes Down syndrome and all that. So now Sri Lanka, it's not a this thing, because termination of pregnancy is illegal. But if you really want to do it, if there's a problem, you can go to India or Singapore, you can do it, like in certain instances. So now in other countries, they will not tell the child that you are going to have a sibling until 12 weeks, if the child is less than 12 years of age, because we are not geared to handle death yet in the family, like there's a child. So it's all important that like as Chaturi said, how you tell about the baby, and then the things like if you are good, we are going to get another child, you are going to get a third child, things like that, not to be told, and to not to corner the child, to keep the child in the circle, and assume the bigger role, like bigger brother or a bigger sister role, so that she or he also responsible, and in a little ways to the little one, so that they have developed this bond.
All right, thank you very much, doctors. I think we have run out of time, so we have left with some few questions, but we will address those in a future session. But I would like to thank all those who sent their honest questions, because these questions help to educate everyone. And I hope that today's discussion is just the beginning, and these conversations will happen not just here, but in every home and in every family. And I would like to thank our two wonderful doctors for generously dedicating their time here today to educate us on these very insightful topics that we need to talk more about. So thank you, doctors, and thank you everyone for joining as well. Until we meet again, stay safe and take care.
Thank you very much. Thanks a lot.
Thank
Thanks, Chatri,
you.
for joining us. Thanks.
And
Okay,
thank
bye.
you. Sorry for the connection issues.
No issues, no issues. Right. Okay, thanks a lot.